Today, let us see the anatomy of knee joint. I will be taking you through the basic anatomy, then into the advanced anatomy. Most of us know the anatomy of knee joint as we report it daily, but still, let us start with the basic anatomy and then go into the advanced part. Basic anatomy, I will be showing you the bony anatomy, then followed by the ligaments uh, and few muscles. And in the advanced part, we will show you the rarely seen ligaments of the knee joint and muscular attachments. So let us start. So knee joint usually is formed by what are the bones? It's the distal end of femur, proximal tibia, okay, and there is patella anteriorly. This is a patellofemoral joint. Then we have tibiofemoral joint and proximal tibiofibular joint. So these are all the joints which constitute our knee joint. So if we see anteriorly, we have the patella. This one is our quadriceps tendon. Tendon inserts over the superior aspect of the patella. Then in the inferior pole of patella, there is a ligament which attaches the inferior pole of patella with the tibial tuberosity. That is the patellar tendon. But actually, it is not a tendon. A tendon is the attachment, continuation of muscle which attaches to a bone. If anything that connects two bones, that is a ligament. So it is patellar tendon or ligamentum patellae. So what is the importance of patella? Patella is the largest sesamoid bone in the body. What is the sesamoid bone? Any bone which ossifies within the tendon. So bone which ossifies within the tendon is a sesamoid bone. So because this bone is ossified within the quadriceps tendon, so we still consider it as a tendon. So it is called patellar tendon or ligamentum patellae. Ligamentum because it is connecting two bones. So that is about the anterior aspect of the knee joint, where we have quadriceps tendon, patella, and the ligamentum patellae. So yeah, if somebody asks us where exactly, show me one point where exactly a ligament gets inserted, like a quadriceps tendon or any ligament or any ligament inserts, it is not like a single point insertion usually. If you see here, the ligamentum patellae goes down. This is the tibial tuberosity, but if you see, it starts inserting from here down till this level. So approximately the insertion will be of 4 to 5 centimeters length. So it is not a point insertion. So a quadriceps or a ligamentum patellae doesn't just go and insert at one point. It will blend with the periosteum of the tibia. So that is same with any ligament. See, if you see the posterior cruciate ligament, it doesn't just go and insert onto the posterior aspect of tibia. It just blends for a length along with the periosteum of that bone. That gives that strength. So if it is a point insertion, it can easily come off with a trivial trauma. So that is about the anterior aspect. So this is our patellofemoral joint. This is a patellar cartilage. This is trochlear cartilage. So that is about the anterior aspect of the knee joint. Then if we see here, what are the muscles here? The superior aspect. This is the superior aspect of the knee joint as we are seeing the femur. So I'm going up. So this is our medial aspect. So it is vastus medialis. This is vastus lateralis. This is vastus intermedius and rectus femoris muscle. They do both come and join onto the superior aspect of the patella, which is reinforced by vastus medialis and lateralis. And this vastus medialis and lateralis, if we see down, they continue as our medial and lateral patellar retinaculum. If you see here at this point, this is the lateral patellofemoral ligament. This is a medial patellofemoral ligament. Then that is about the muscles there. Then if we go into the knee joint, what are the ligaments we see? This is the anterior cruciate ligament. Because of its angulation in the MRI, high fluid content, and arrangement of the fibers within, we get to see hyperintense signal, which is a normal signal within on PDFS images. So we do an oblique search for anterior cruciate ligament on T2 weighted images to look for any tear. So that is the reason we do oblique search along the fibers of anterior cruciate ligament, because on routine PDFS images, we see hyperintense signal, which is normal actually. These are posterior cruciate ligament. Okay, posterior cruciate ligament. This is anterior cruciate ligament. Then we see this is the medial meniscus, lateral meniscus, lateral because we are on the side of fibula. So if you see, this is a medial meniscus. So meniscus has what? So body of meniscus, this is the body of meniscus, anterior horn, posterior horn, and still if you go into the center of the joint, medially, we see the roots. This is the posterior root, and this is the anterior root of medial meniscus. If we go further laterally, we see the body of lateral meniscus, anterior, posterior horns of the lateral meniscus, anterior root and posterior root of lateral meniscus. So these are menisci, ACL, PCL, and I have shown you the ligamentum patellae, quadriceps tendon, medial lateral patellar retinaculum, medial and lateral patellofemoral ligaments. So then if you see here on our coronal images, this is the medial collateral ligament. If you see here, it is starting from here, going down and blending with the periosteum till the proximal shaft of the tibia. As I told you, the ligament don't just go on insert at one point. So that is an important point to be noted. If you see this lateral collateral ligament, you see here, this lateral collateral ligament is joining here, blending with multiple other tendinous insertions, and also joining the periosteum of the femur. And if you go down, it is getting inserted onto the head of fibula. So this is our lateral collateral ligament. So this is what I wanted to cover in the basic anatomy of the knee joint.